Good. Thank you to all of you who are joining us virtually on Zoom. First on the agenda is the consent agenda. The only thing on the consent agenda, of course, is the minutes from the February meeting. Has everybody had an opportunity to read those? And can I get a motion to approve?
So motion.
Second?
Second.
Any corrections, edits, changes, anything anybody noticed? Okay, all those in favor say aye. Minutes passed, thank you.
Can I just double check who motioned?
Dr. Cantrell was the motion.
Cantrell,
Karen was the second. Okay, next up is the debrief funders council meeting, March 25th and April 7th. So I'll take this and Amy might join in, maybe even Kevin, who was in attendance. So there was a funders council meeting. For all of you who don't know, there is always a funders council meeting. They meet, as you know, there's two standing councils under the CoC. One is the providers council and one is the funders council. The funders council was on the agenda, was going to take action on the funding priorities. So those of you who are here in the room and online will remember that over the years, the Providers Council has actually taken action on both funding priorities as well as population priorities. This year, Amy had I thought, a very strategic idea that the Funders Council really should be making some decisions on funding priorities, and then based on funding priorities that the Providers Council would make. I feel like my back is not to the audience. So.
Good point.
So the funders circle back with anybody about that, but the only two providers who showed up for the conversation was Kevin Marone Foley and myself. And the conversation was the conversation, in my opinion, was a little light. I do sometimes worry that funders without providers have a hard time having discussions around these issues, quite frankly. If you don't fully understand the issues, sometimes the decision doesn't seem as robust as it could. We did, both Kevin and I, have an opportunity to speak to any number of items that they were discussing. That day, they did not actually take any action on funding priorities. It was decided instead at that meeting that they would have a combined meeting between the Funders Council and the jurisdictional meeting. And so that meeting was set for April 7th. That happened this week. And I attended that meeting as well by Zoom. As opposed to in person, and I think Dr. Cantrell was there on behalf of Lori Matway in the school system. But other than that, I think we were the only providers. So this time it was you and I for that discussion. So ultimately, what I want all of us to know is that the Funders Council and the day before, whenever it was, that they voted on two funding priorities, which is prevention and rapid rehousing.
No, it was three. So they did prevention, housing navigation, and rapid rehousing with PSH as the third.
So prevention, navigation / rapid rehousing, and the third being PSH. Okay, so I didn't hear that. I knew that PSH was being discussed. I didn't know that it was on the list.
Unless it changed at the end, I'm trying to pull up minutes.
Okay.
It says prevention funding, rapid rehousing with focus on navigation and permanent supportive housing.
Okay. So to that meeting, quite frankly, is that by focusing on good afternoon, Paige. No, you're fine. By focusing on, I think prevention, as you know, prevention, we have always voted on prevention in the past, but there has not always been a lot of funding for prevention. With a lot of the CARES money and the COVID money and that kind of thing, prevention really has been quite effective and quite meaningful. However, in addition then to prevention is the in-between. So my concern about what the Funders Council took action on is prevention, navigation, rapid rehousing, permanent supported housing is what's happening to people in the meantime. So right this minute, right this very second as we sit here, there are 70 families with little bitties on the streets right now. So what? I wasn't in the room, which is always frustrating to me. But the question is that if we are prioritizing prevention, hallelujah, amen, we should do that. And then rapid rehousing, absolutely, and system navigation, absolutely, and permanent supportive housing, absolutely. We don't have enough of either. So I don't know what it means to prioritize our funding for those funding sources, because we have people who are right now languishing literally on the streets. I know that I speak about families often with children. I hope everybody knows that the reason I speak about families with children so often is because we lack adequate shelter for them. So individuals generally have a place to shelter. Generally speaking, individuals have a place to safe shelter, whether that is at Safe Harbor or at Pinellas CoC or at Salvation Army or some of the other, HEP, some of the other shelters that have capacity for single adults. What we do not have in Pinellas County is adequate safe shelter for families, in particular safe shelter without a fee for families. It is costly to shelter families. So I made that point with the Funders Council and the co-jurisdictional meeting. Doug had acknowledged, my contribution. However, he said, we're going to have to come back to that. So no action was taken on that. So I am very, very concerned about it. I'm going to also say to you, probably, not wise for me to say it, but I'm going to say it regardless, which is that my expectation following the first Funders Council meeting that then resulted in them coming together was that when they came together as the Funders Council and the jurisdictional meeting together, that action was going to be taken yesterday to really address what we have happening right now. Like, I fully expected that group yesterday or the day before, whatever day it was, I was fully expecting that they were going to say, wait, we have 70 families with little children on the street right now. We need to take action right this minute. And we need to go back to our respective jurisdictions. We need to look at what we can to make movement. We're going to commit to taking at least one family off this list a week. We're going to commit to taking, all of them off the list. We have the money in Pinellas County to take people off this, to get people off the streets. We just simply do. So I was a little disappointed that what they ultimately made the motion on, by the way, it takes effect, I think they said January of 2023. Am I correct, Amy?
Mm-hmm.
So this priority action that they took, which, by the way, I do not believe is a full picture of what we needed because of the people on the in-between. Yes, those things need to be funding priorities if we're talking about the big picture. But right this minute, we have a different picture before us. And And it worries me so. And I'm sure it worries all of you so. But, you know, I get text messages. Everybody and their brother has my email, my phone. Literally, I get one this morning about a 36-year-old mom. She's got a little girl who's 7, right? They're living in the woods. And so we have, and I don't even know if she's on the list of 70, for example. Like, is she on that list of 70? I don't know. Is she number 71? I don't know that either. So it's that kind of thing that I am concerned about. Hi, Nikki. So in any case, and she goes to, you know, she's in school. So in any case, we then, I want to give all of us an opportunity to talk about this particular agenda item. It does, of course, lend itself to the next agenda item. Just as a reminder, what the Funders Council was asked to do at that initial meeting and then at the follow-up meeting was to take action on the funding priorities. And based on their action on the funding priorities, that we, the Providers Council, would be taking action today on the population priorities, which of course need to go hand in hand with the funding. I've given a lot of thought to it overnight, thinking about, you know, for example, I don't know how we, for a population priority, could prioritize families with dependent children or even the elderly who may perhaps need different types of assistance if the Funders Council didn't prioritize how we would safely shelter those groups. Because prevention, yes, rapid rehousing, system navigation, and permanent supported housing, absolutely, but our most vulnerable people are on the streets. And we didn't prioritize any funding related to that. Am I making sense? Okay.
Kevin has his hand up. I do want to just mention one part from the first meeting for everybody, because I'm sure many people would be sensitive to put anything in writing around this, but you know, the first meeting, there was a lot of discussion around trying to get funders to understand the challenges that providers are faced with, particularly with payment and timely payment. So, you know, that was really why they never got to prioritization. I am, you know, trying to work behind the scenes as a part of your benefits of membership, trying to advocate for the needs of our providers and help funders understand that challenge. I have received a lot of, you know, support of that understanding from funders, and they're asking for additional information. So what I'm hearing in some jurisdictions, and I don't want to paint with too broad of a brush, but when I go to my staff, I hear that's an isolated incident. If you bring to me and show me that there's a larger problem, I will address it. So I've thought about calling CEOs who are funded to say, tell me how many months behind the county is, the city is, whatever. I think right now my approach is I'm going to put together an anonymous survey and try to gather some of that data so that you could feel like you can share that information anonymously to say, you know, our slowest payer is such and such, here's the challenges we're experiencing, whatever. So if you have thoughts about that, of which approach you think is better, feel free to reach out to me. I have been asked by our funders for this information, and I want to be able to go back to them and show them this is not a one-off. I'll just speak for myself because, you know, I'm comfortable using myself as an example. We haven't been paid by the city of St. Pete since October for ESG or CDBG-CB. When we follow up, it's not because something's wrong. They haven't even looked at it. And that was a part of what the first meeting got, you know, the prioritization pushed back, because providers have been trying to say, we can't cash flow you for 6 months if you're not going to touch it for 6 months and then come back and say there was a problem and then it's going to be 3 more months before you pay us. So if you have thoughts about that, or you thoughts about how we can present that as an aggregate, I'm happy to share that.
I do appreciate you bringing that up because I skipped over that part and should not have. You are right. That is why action probably was not taken that day on the funding priorities. We did have a lengthy discussion. Again, I'm not a part of Funders Council, so I'm not sure. I don't believe that it was as robust and as complete of a conversation as it could have been had, you know, we all had an equal seat at the table, so to speak. Amy does do an incredible job of trying to help the funders, as she just said, understand. One of the things I learned that day, though, is, and I think it's important to say it here, one of the things that I learned that day is, so the HLA, who is our lead agency, right? The COC has identified the HLA as our lead agency. They, under Amy's leadership in particular, but get all the information from HUD and all of the funding sources. If you've ever read a HUD document, all right, it's 752 pages long, you know, 0.1 font, right? And it's got an incredible amount of if this, then that, here to, therefore, don't do business, right? And so when the government and others had the foresight, in my opinion, to release all of these funds to communities across the country in anticipation of what they believed was going to become a significant problem with homelessness, P.S. they were right. And all of these funds were intended to prevent that tsunami from hitting any community, right? In this case, our community. So all those funds get pushed out. There's, you know, tremendous guidance in all these documents. Amy and her team have spent a great deal of time digesting those requirements and pushing out through trainings and technical assistance and a variety of reports and things, the waivers and a variety of things that were available to us. As you know, ESG has been a funding source in this community for decades. This ESG CV, what the CV, the coronavirus aspect of the funding did was it provided for a variety of waivers. So for example, ESG dollars historically, right, require, and I'm just going to give you a couple examples, require a 12-month lease, for example. They require that the housing has been inspected and meets a full inspection. Under ESG CV, there were a whole host of waivers that were available to us. HLA, who received additional ESG CV money, subcontracted with their current ESG provider, which was Directions for Living, pushed that money out, requested the waivers were approved. We moved forward as a provider with the waivers. We believe, Directions for Living believes that, and I'm assuming all of our ESG providers believed that every one of our jurisdictions who received ESG CV money also applied for those waivers. We discussed it ad nauseum in the 72 meetings that we attend on behalf of the COC. We talked about those waivers and all of those things, right, as we move forward. Well, it turns out that most of our jurisdictions who received ESG CV money didn't apply for them. So because of that, I'm owed $400,000 by the city of St. Petersburg, who has refused and has denied payment for all of it, predominantly because the one they cite the most is it was a 7-month lease. Somebody who had a 7-month lease. It's like, yep, they did, because that's what we had to do, right? House Bells, we'll take a 30-day lease at this point, right? Just to get people off the streets and negotiate it later. So there was that part of the discussion at Funders Council. I have to say that I know with 100% certainty that all of the funders who were sitting at that table and who were online didn't fully understand what Amy was saying to them. And I know that because of the types of questions that kept coming back. So Amy says, you know, about all the paperwork, for example, and then one of the funders online says something along the lines of, We know all of that. Okay, that's fantastic news. 8 seconds later, but we still have all of our processes that require the 1 year lease, the this, the this, the that, the this. And I'm like, okay, so you didn't understand all that. I do appreciate that funders, what they are facing, right, is not client facing, right? They don't have a full, sometimes picture, I think, of, which is the reason that providers and funders just have to work in harmony together because of these dynamics. So we did have that conversation. I think it made some movement, but there's still so much movement that needs to happen at the funders table, as evidenced by, quite frankly, the decision that was made yesterday, which is we're going to prioritize prevention, absolutely, and rapid rehousing and permanent supported housing. By the way, there is none of either. So we could have, our funders could say right this second, we're going to put $6 bazillion in rapid rehousing and permanent supported housing. We're going to put $6 bazillion in there that you can have for that purpose. If there isn't any housing or permanent supported housing to put somebody into, that $6 bazillion is going to sit and we can't do anything with it, right? So this piece of, so where do they go in the meantime? What are we doing in the meantime? Is a funding priority that has to be discussed. Kevin?
Yes.
Your hand is raised, you're acknowledged.
Well, that was a while ago, I mean, my comment was more, I guess, at the start of your thing, more about the second meeting, which I was not able to attend. In fact, I didn't even know about it somehow. It did not get on my radar or calendar for the second meeting, but I was wanting clarification on your concerns of those priorities. You sort of answered it later with, we're going to come up with populations, because to me, those three categories are, broad, would include families, individuals, and anyone, because there's families in permanent supportive housing, there's families in rapid rehousing, there's families in prevention. So I'm trying to better understand your concern of those, and then what the next steps are.
Yeah, so
Because I am building housing, so I am looking for funding for permanent supportive housing. That hasn't stopped.
Yeah, so my answer to you is that when we get to talking about priority populations, we have to be mindful of the funding priorities. So, for example, if we were to say that families were a priority population, the funding priorities right this minute, it would work for prevention, it would maybe work for rapid rehousing and permanent supported housing. The question is where are they going to be in the meantime? If we're talking about chronic individuals or individuals in general, we know where they can be in the meantime, right? We can work with Safe Harbor, we can work with our shelter providers to say they're on a rapid rehousing list, for example, based on vulnerability. They're on a PSH list based on vulnerability. And in the meantime, they're going to be in Safe Harbor. They're going to be in Pinellas CoC. They're going to be, but with families, we can prioritize them, but where are they going to be?
I think the other point, Kevin, that I would just clarify too, so everybody's on the same page. The discussion that funders had, we did try to make it very clear that the priorities they were setting was for their own local funding, not for any future HUD NOFO. And so, there is the opportunity for that to be reordered for other funding sources. And if I had to think about how they got there based on the data that was presented to them, we did present to them the data tables from Florida Housing Finance to show the need for chronic beds, what are the needs for child welfare involved folks, what are the needs for DV, exits from prison, et cetera. I think the elephant in the room they were trying to address was backfilling ERA that is planned to end this summer, which is prevention, and then dealing with the backlog of the number of individuals awaiting rapid rehousing. Last year it was 500, this year it's almost 1,200. So just to kind of let you know how they got there, I don't know if that's helpful.
Well, no, that's very helpful, because that's, I mean, to clarify, my question was, what is the recommendation if not those three?
Well, what I had hoped for yesterday, right? I understand backfilling ERA. I understand, you know, in January of 2023, what I'm concerned about is, you know, April 8th, 2022. I'm kind of concerned about right now. And so what, if not for those three, Kevin, my hope, and quite frankly, what I really thought was going to happen is that the funders would have the discussion that when Amy and her team presented the data, by the way, the data was powerful. You'd have to see it.
I'm going to put it in the
data is powerful. It certainly illustrates beautifully, quite frankly, that prevention works, right? That we prevented so many people from entering homelessness over this last 18 months. We as a community, we've done amazing with that, which obviously speaks to our funders and incredibility of our funders. However, what I was thinking and hoping and believing that was going to happen yesterday is when Amy and her team presented the data and people understood that we have right now, I can't remember what the number is, but 70 elderly people. Our number has quadrupled. I think it's increased by 700% or something of people who are elderly and disabled who are living on the streets. We know of 70 families with little bitties on the street that when they heard that, they would say, we have to take action right now to address this issue for August 8th, 2022. And we can come back to what we need to do to backfill ERA for January 2023. That what we have to do right now is go back to our local jurisdictions. We have to look at, by the way, the other data that was presented during this meeting, at both meetings, is the amount of money that has not been spent. So the money that has been received by Pinellas County that has not been spent. So now those numbers are slightly inflated, by the way, because, for example, the $400,000 that I've spent and not been paid is in that bucket. So it looks like $400,000 hasn't been spent when it has. The same is true for Amy. The same is true for St. Vincent de Paul, and who is also behind by months and getting reimbursed.
One of the things that maybe Amy could do in the survey, and you know, I go way back 30, 40 years. Why can't they give us some kind of advance? If they're gonna stay home and they're not gonna process our stuff, that's okay. I'm okay with that. But
we have made that recommendation.
give us something to help us through it. And maybe if you have, I mean, I begged the other day, and I was talking, I won't say whom, and I said, can you just give me one? I'll settle for one.
We did conduct a call with our HUD TA and the city. The county was invited and did not attend. And that is what the HUD TA actually recommended, was that they need to advance. We provided in follow-up to that meeting how DCF assesses risk in order to do advances, what their applications look like, how all of that happens. And I mean, frankly, I don't know why HUD was talking to me, because they're concerned about the county not spending $2.7 million while we have people on the street. And I can't answer to that.
Well, you can't spend it if you don't have it. And so part of the things is now they give us the money, but you're so far behind that you can't spend anymore because you have the cash, and you have to watch your payroll, and you have to watch your line of credit, and you have to watch all those things. If you remember back in the Hopla days, they always gave advances, and because there was so much money flowing, people couldn't get it out the door. So they would always give you advances. They gave up to 3 months of advance. Wouldn't that make us a difference right now?
Yes, so again, back to the, absolutely, you're absolutely correct. And I will say again, you know, the HLA as the lead agency truly has done, in my opinion, just about everything that can be done, including scheduling these meetings with the technical assistance with HUD, getting our funding partners on those calls to hear it straight from them as opposed to only hearing it from Amy. By the way, if you look at this funding sheet that is being provided to Funders Council, and again, I think you guys should look at it as well, is
We're emailing it to everybody right
okay, so if you look at the money that went to HLA, the same type of money, ESGCV money, the exact same money that went to the county, city of St. Pete, city of Clearwater, city of whoever, right? Because we've got, you know, 76 jurisdictions, that's an exaggeration, but we've got, you know, everybody who's got their own city councils, everybody who's got their own everythings. And we blame providers, right, for being siloed, when actually what we should look at is our funders who are actually siloed. But if you look at ESGCV monies, for example, those monies that went to HLA for administration, HLA received, I don't know, somewhere around, I think, $1.2 million. If you look at this document, they are 100% spent. 100% spent. We needed to be 80% spent by a certain time. We're 100% spent. And I've been arguing and advocating for a long time, and I really wish we would have the voice of all of us on this issue, which is if HLA is in fact our lead agency, and they are, why can't our municipalities and our city governments and our county governments contract with our lead agency? And have our lead agency then contract and subcontract, which is what they currently do, right, for services, because they are the experts. They are digesting this information from the funding sources. They're putting all of the strategies in places to ensure the safe and effective use of those dollars. HLA has spent all of their money with their subcontracted providers. We have many of these who are literally 0% spent. If it's not all spent by the HUD has recently released an extension to September 30th. September 30th. If it's not spent by September 30th, the money is going back. It's being returned. I want you guys to hear all of that in the context of we have thousands on the streets. Why would we? So I understand, Kevin, the funding priorities for January 2023. Right, being the prevention and backfilling ERA. What I'm trying to understand, and don't feel like I have a, you know, I don't feel like I have a solid understanding of why do we have so much money in this community unspent? It has to be spent. We have people and families in particular, but the elderly and chronic individuals who need these funds, and we're not doing it. That's the question.
I think there's lots of factors. I mean, you can't get staff. It's hard to get staff. I don't care if you pay $60,000 a year for a case manager. It's very difficult to get staff. And then the agencies aren't getting their money. I mean, it's everything. It's just not one thing. It's everything. And I think the only thing we can do, and Amy and you are right, is we all just have to go to the funders, and the next meeting, you should just call on everybody to go.
Well, we did, and we didn't
But
collectively
do it really
show up.
forcibly.
Well, I'm just saying we all didn't show up, and we need to show up because I believe in my heart, from the tips of my toes to the top of my head, the funders want to get this right. I know they do. And I know they do. And
I do feel like they're really trying
they
and they
are.
want to make the difference.
They do.
They just need.
They don't know how. And to be fair to them, as a collective group, I'm speaking generally, to be fair to them, there is a lot of if this, then that, but therefore, how come, don't do. There's a lot of rules that if this isn't your sole thing that you do, managing ESGCV is different for them, which is why, right, the assumption was early on, my assumption, you know, shame on me, but my assumption early on was when we were making all of the decisions and having all the conversations about the waivers and all the things that were available to us that would allow us, because all of us who are ESG providers, when that money started to flow, we immediately were saying, but oh my God, we're not going to be able to get a year lease. We're not going to be able to get an inspection done. We're not going to be able to, we were saying those things, and HUD was like, oh, no, hey, hang on a second, we got waivers for you, right? You don't have to do all those things because we don't want this tsunami to overcome your community. So I do think that the funders want to get it right. I mean, if you sit at those tables and you hear the voices of many of them who are truly trying to figure it out, but the puzzle is vast and putting the pieces
Well, they
together.
have their jurisdiction rules.
Correct.
And then they have the ESG rules, and then they have the who's rules and the what's rules, and it's difficult. because
Yeah, and they
you
have
gotta-
the plans that they put together a year ago, and the plans, you know, tell them what
It
they
has to
can
be
and can't do,
approved.
and correct.
I do think, I mean, I want to draw attention to that though, and I just had Brianna email out the PowerPoint. I do think that is a part of why the action, it's difficult for people to understand the puzzle, right? And I do think that is why action wasn't taken on any other priority possibly, because at the end of that PowerPoint, you'll see that we presented 3 ideas for the county to do with their 2.7 million in ESGCV. HUD has said to us, tell us what you're going to do and we won't recapture it. The county is feeling like, do we do anything? Because they might recapture it. We don't want to put a program in a bad place where they hire people and then have to let them go. Understandable, right? That's not easy for any of us to do. I think where they're feeling additional strain is it's in certain buckets, right? So there's the intervention allowable. The non-congregate shelter bucket is spent. And so in order to make that change, they would have to do a substantial amendment. And there's not time to get a substantial amendment before September. But I mean, I believe all things are possible. And that if we push and say, we gotta figure this out, let's get HUD in the room, let's figure it out, then, you know, maybe we could get there. So I want to acknowledge how I think they
Yes.
didn't get there, but I know why they didn't get there. But we did present 3 options for, you know, and what the pros and cons of those 3 options were.
And in that PowerPoint, what you will see is, you know, by the way, you know, back to something Sheila said about the spending of the money. The fact of the matter is that we've projected that we could literally by September spend $2 million in non-congregate emergency shelter. Literally without question, we could spend $2 million. We could get everybody who is highly vulnerable, the elderly and families with littles, off the streets. We could spend $2 million. The challenge with that, of course, which is why, you know, I believe, by the way, we could solve any problem working together. I really do believe if we have the will, we can do it. HUD wants us to spend the money, by the way. They don't want to recoup it, recapture it, take it back.
That's too, everybody wants us to spend money.
Correct.
That's the challenge.
The problem with putting people in hotels and spending the $2 million, one of the things that we learned very, very quickly, right, is you have to have an exit strategy for people in hotel. They've got to have a place to go. And otherwise, we could keep somebody in hotel for 18 weeks, only to then find them on the street again because we didn't have a place to exit them to, right? So the pieces of the puzzle really are difficult and challenging, and it really does take, you know, people who are really, really good at puzzles working together to figure it out. But there are people that are really good at puzzles in this room. And online and in our funders council and our jurisdiction meetings, we just have to do it.
So 2 things first. You've sent that PowerPoint. I have not received it. looking, and I don't care, and you haven't gotten it
Yeah.
either. So I'd love to see the sheet in each of the entities. I think the other piece that needs to be, group that needs to be in the room, in addition to those that are representing the jurisdictions, is, I'm guessing those are from whoever is handling the ESG dollars, but it's not including maybe the fiscal department at that jurisdiction who's going to be doing the accounting on that. That's a whole separate department in the jurisdictions. So that department for housing has to then work with their housing or their fiscal department, who then is also working with their auditors. You know, in the large CARES dollars we really had to get all of those groups, because that jurisdiction person would have to go and speak with the finance department, and then they have to talk with the auditor group, and then back up the chain. So it would help speed things a little bit if the next jurisdiction meeting could include not just the person who's representing the housing department, but also bringing along a finance representative from that jurisdiction, from the finance department, which is usually a different department, and whoever would maybe be the auditors for that, because that slows down. And from my experience doing the CARES mission rollout, that was slowing down the process to kind of make changes.
Yeah, and
So that would be a
that is
suggestion I
true,
would make.
that is absolutely true what Nikki is saying. So let me speak to that, two things. One, yesterday's meeting, this week's meeting that happened between the Funders Council and the jurisdiction meeting, nobody from any of the departments that you just referenced showed up from the city of St. Petersburg. So they just simply weren't there. Actually, I think there was one person there online from one of these departments, the finance department or something, but the right people nonetheless.
But it was their council day that let us know that that's why they.
Sure, okay, sure, okay, fine. Nonetheless, and Teresa was there representing, but of course she acknowledged that those weren't her departments, and she did not feel even comfortable. She didn't even feel comfortable participating in the vote, right? My second point to what you just said is, though, when we were struggling to get reimbursed timely by Pinellas County ESG, we had an opportunity. I met with the assistant county administrator who oversees that department. He was lovely and wonderful. Within days, he had every invoice paid. And then he set up a meeting. I went and met with them. To your point, they come from two separate, right? They don't even know, they've never even been in the same building with each other before. And they are separate from the people that we interact with at Funders Council. So Joe Riddle was not in that meeting, for example. And so all the things that they're saying that Joe knows, they're saying they don't know, right? So these departments, to Mickey's point, all need to probably be in the room and invited to participate in Funders Council. Because again, like the one department at the county, I mean, they're all working 12 hours a day. They're processing, 100,000 checks a week or something. I mean, it's not that they're at home, not touching it. It's that literally they are working night and day to try to get every invoice paid, right? Michael, did you have something? Did you get it?
No.
Oh, from me. Does it came from me? I forwarded it to them and they got it, but it came encrypted.
Yeah.
I'm over here like, I have no idea what that password. No clue.
Yeah, I'll forward this.
Okay.
You give you.
Oh, she did send it to you too. Okay, I'll try.
Okay, so with all of that in mind, we are expected to take action today for the priority target populations for funding. I have thought about this all night, trying to think how we could frame this, because I believe that the priority populations for right now, today, April 8th, may be different than the funding or the priority populations that would fit with January 2023. I need you to help me
Yeah, I mean, I can pull up any data that you would like to see. I do think some of the data that was presented to funders could possibly be helpful when we look at families versus individuals, that kind of thing. I mean, I've thought about it too, about how to approach it today and what to provide you to help you make this decision. And I mean, this is why this is hard every year, is because everything's needed, right? And we're doing Built for Zero for chronic. So I feel like we already made that decision. When we decided to do Built for Zero, we decided chronic homeless individuals were important to us. We last year made a decision that seniors 62 and up were a priority population, as well as families with children 0 to 5. We need it for everything. Our individuals are, I mean, exponentially increasing because we focus so much on families. We've got to do it all, right? It's not a zero-sum game. Whatever we decide, there's a need for everything. So I'm happy to share my screen and pull up any, data that would be helpful to help you.
Okay, new to the council, and I'm representing Kevin here. And I guess the question I'm having is, how will a decision we make today have the impact that you're looking for, that we need today? Because what you need today sounds like we need somebody to give us some of the money that was just left to some of our outlets around the county, and find a warehouse and create a shelter for families until we can build housing for families, because we don't have enough housing for families, and certainly larger families.
That's huge.
And that's where we get into the problem. You can't put a 6-family unit into a 2-bedroom. And then I know from Bowley's standpoint, we've only been able to build maybe 2 or 3 per property, 3 bedrooms. Those fill up quick.
I think so. Another potential thought, but I don't know what the funding streams, I mean, it's obviously federal funding, and it went to jurisdictions in certain areas. We've been talking, because we've been working with United Way, Suncoast, on eviction dollars cohorts in each county that they serve, and we have already started asking them, is it possible to be able to use the dollars that are for Pinellas to move them and place them in another county? So is the ability to use these funds, we talk about available housing, that may be looking, it's not popular, we want to keep them here in our county and keep families and kids in school, but we're not going to build housing quick enough. So is there a way with these dollars to ask about crossing jurisdictional boundaries?
So what you're here today to talk about is how to deal with local funding priorities, right? So when Karen brings together a social action funding committee, they should be using, this is what the HLA has set as their priorities. But to answer the question you're asking, DCF allowed the money they pass through to us, that we pass through to Directions for Living through an RFP. They allowed us to move people anywhere in the state, but you have to remember that their federal dollars were to the state, so they had less regulations around that. Clearwater and Largo, for example, allow us, because we do housing navigation for them, if people originate there, we can relocate people anywhere in the community they want to go. The city of St. Pete previously has not done that. However, I gave them in writing recently something to show that HUD says, yes, it is client choice. Clients should move wherever they want to move, and we will reimburse you for it. So hopefully.
But the answer right now is no.
Right. But so there was some conversation about this at funders though, like Kathleen Beckman said, I don't care where City of Clearwater dollars are spent. Let me make this request for dollars and let's get people housed. I don't care where. Having served as an elected official, I will just tell you that that usually gets sticky. I really can't imagine any of our elected officials saying, sure, take our tax dollars and go somewhere else.
Although I do think it's worth a conversation.
I do think
They
it's worth a conversation.
originate in the city of St. Petersburg, for example, which is what we ran into. They literally born and raised in the city of St. Petersburg. As you know, very little affordable housing in the city of St. Petersburg. We were able to find people housing in Largo, let's just say, they wouldn't allow it. They said they had to remain in the city of St. Petersburg. So I understand people originating in their communities are who we are prioritizing, but where they ultimately go, right? Go ahead, Nikki, and then we'll get to you.
So I do believe it does relate to the target populations that we're asking. Because if there's no housing for them, say, one, you have families on the street with children. And, okay, you can keep them in their housing, but once they're out, you can get them maybe on, prioritized on a rapid rehousing list. And the 70 that are already there, you know, being able to move them, use dollars, if they can move them across anywhere in the state of Florida. And since it's federal dollars, I think some of it could move anywhere, frankly, that they could do that. So I think it does relate, you know, a little bit of choosing what are the priority populations. There may be more options for seniors than there are for families with minor children based on housing stock. I don't know, but I think it's another piece, small piece in it as well to make that decision.
I agree. If we could get a commitment from funders, when I say funders, I mean funders and the jurisdiction group that of this issue, because then I would have less heartburn about prioritizing families. I don't want to prioritize families right now because I'm like, where are they going to go? So we are literally saying we're going to prioritize them, sure, for prevention. If we put them at the top of the list for prevention, sure. But for the families who are already homeless, right now we know we have 70 of them, possibly 71, whatever that number is. Where would they go right now?
In Pinellas County.
In Pinellas County. Now, if we had money in rapid rehousing that could be spent and we could move them out of Pinellas County, well, we could probably do that in a matter of weeks. Now, I did hear that the housing stock in even Pasco County is, right, didn't I hear that somewhere, that they are almost out of,
Hillsborough's kind of the
but some of maybe the you know, smaller, you know, communities, you know, moving north. So I'm gonna get to you.
So sorry.
No.
I'm the new guy,
That's
so
fine.
I have no business speaking up, but it is absolutely okay to say that, hey, we've all thought about this. You are all incredibly intelligent. I am incredibly grateful to be here in this room. Just let me say that. But it seems like housing is going to be an issue no matter where they are. So somebody who is chronically homeless here is going to inevitably be chronically homeless wherever we send them. And so if we're able to pair these people with the mental health and substance abuse services that they need, these children will oftentimes be much better off than they are currently. And this is just a question because I am new and I apologize for that.
No.
Has anyone talked with Homeless Alliance of America about, nope, that's who we are. All right, Hope Villages of America, we used to be RCS.
Mhm. Yeah, they're a part of Providers Council. They're not here today. They may be online, but
So I
but
believe they
yes,
have some, you know, specifically for families.
they do. And we keep, you know, I think we keep them full. They're a part of our family system flow. So we do keep their shelter beds and temporary emergency beds and that family beds full. And so, yes, we are working with Hope Villages of America and all of them.
Then my next question is, because I figured as much, I
Yeah.
apologize for
No,
the
no,
stupid
no.
question, that's on me. But the next question would be, why are we not trying to focus on transitional with the expectation of them getting permanent? It seems to me that there are opportunities available for families that we are not exploring. Now, keep in mind, if nobody will pay us for 6 months, no provider is going to be able to accommodate that. But at the same time, people who are on the street now.
So, you know, transitional housing used to be an intervention that we used quite a bit for all of our populations. HUD made some changes years ago that transitional housing is an appropriate intervention for 3 groups. In particular, those who are living with a co-occurring or substance use disorder, those fleeing domestic violence or who have entered domestic violence, and youth under age 18 or youth aging out of foster care. Other than those 3 populations, there's really, so our system,
To these families, because I'm focused on the 70 on the street. do
Yeah,
not
thank
fit
you.
into that category.
most of them do not
Then
fit
that's-
into that category.
That answers my question.
Now, I will say, but it's a great question, and it's a great part of the conversation, because some of, in my opinion, some of the challenges that are facing us probably are facing people across the country because of the pandemic, because, you know, the strategy of moving to rare, brief, and one time for homelessness prior to the pandemic, right? We were eliminating emergency shelters, and we wanted to take people from the street to housing, and, you know, we reduced transitional housing processes and those kinds of things. When the pandemic hit, you know, some of those things then became, we didn't have enough temporary emergency shelter for families. When we could cram them all in the same room, we still didn't have enough. And then when all of a sudden we had to have 6-foot distance and everybody couldn't be on top of each other, we sure as heck didn't have
You know,
enough.
though, I mean, what he said, and it's not transitional housing in the definition of HUD, how it defines the intervention. But, you know, sometimes there's providential moments. So he used that word. Danielle had to rejoin from Catholic Charities. And I mean, I wonder if there are solutions that would spend these dollars that we're not thinking of. So for example, I believe Catholic Charities in Hillsborough brought a vendor called Pallet or you know, something.
Yeah,
And
I'm here. Amy, yeah, we did. We're in the process of purchasing the pallet shelters, which
So
is going to be sort of a new version of the cottages. Yeah.
And you don't need, you know, any kind of skills to put them up. We could get church volunteers to put them up. I mean, that may be a very quick way to spend the 2.7 million sitting there, that then it's not the solution we want for people. And so maybe, yeah, where's the land? That's the,
We find somebody to be willing to have these on their space, and we can even spread them out so that they're not all in one place. Specifically because of the PR issue of essentially creating another tent city. You know, if individual, like churches, programs, other types of stuff are willing to house them, we could make this happen relatively quickly.
Yeah, I mean, I would love for us to be, you know, it's those kinds of things, that kind of thing that I think is amazing. I also am all of you may remember that, you know, when Bob Dillinger was our public defender, Sarah Molo is there now. I haven't asked her about it or talked to her about it, but one of his staff used to talk about that they had, and I'm going to forget the number, but it was some very large number, 300, 500, 800, I don't know what, of shipping containers. You may remember, and
We have the,
do you remember?
yeah, Darren had access to the military, from the US Army, the tents with the air conditioning's already in them. And he just wanted somewhere to put them.
And you just wanted somewhere to put them. And so, you know, again, I think, yeah, look at this. These are, I mean.
and Dolores is saying that Pence has a property available. So,
I love it.
you know,
Yeah.
So when we already have these things in existence that we can get over here and for help volunteer for people to help set them up.
Look at that. That's beautiful.
So can I ask, I wasn't at this meeting yesterday, but was there an appetite to have further discussion by the multiple funders who have money that's lasting?
I think there was, I think that towards the end, they were feeling rushed, that they had to take action, they had to have something. I think that there was an appetite. I certainly think that, again, we're trying to solve very large problems in an hour, right? Like people are coming together and they have an hour. We do this all day, every day, in addition to 750 other things, but we have a sense of how this works. And I'm not sure that they all do, but I think the answer to that is yes.
And I'm not trying to derail the agenda, I'm just, how do we how do we decide on the priority population when we have this glaring problem?
Yeah,
So I'm wondering if the strategy here is, who takes the lead on meeting with, the individual funders, the municipalities who have these large lapse dollars to help them spend the money.
Well, I think my opinion is that it is the HLA, that nobody does it better than the HLA, Amy in particular, and generally speaking, that the HLA's voice seems independent of a particular provider, right? The thing that I sense often is that when providers speak, I'll speak of myself, right, that somehow it's self-serving, right? Like that it's only about, well, directions just wants the money. I need everybody to hear me say that's not it at all, right? In any case, it really is about,
You have a contract, you do have a right to be paid.
Well,
I have the right to be paid, but in
I had
addition
the
to
same-
that,
I had the same conversation with another provider yesterday, trying to come up with very creative solutions for the $2.7 million. And so I said, please bring those ideas to the department director and talk about how
But
you can creatively come up with that solution. And the provider kept saying, it's not about my organization. I'm not saying we want it, but I understand how to spend it.
the only community that is going to lapse is the county. So you may be able to help. I feel like I'm not getting
where she
that
needs to get.
message. The partners I'm working with in that department are working with me, but they're not higher level people. And so,
Not the fiscal and the auditor group, I think.
and that could be helpful. And you've made that connection multiple times, but I can't even get an email return. So
Okay, so I will take that on, just for everyone's clarity, because it's a different department. And so it's under the county, yes, but it's not human services that has $2.7 million. So it's another department. We've tried to work. So I will take that on as another task to schedule a meeting with Amy and possibly both ACAs, because it's under two different ACAs. It's like completely separate parts of the house. So I'll take that on as a responsibility to see how we could creatively come up with a plan for the 2.75.
So, does this get to,
Yeah, I don't, again, like I said, I thought about this all night, right? I'm up at 3:30 in the morning. How in the world could we actually do this? How could we actually, I think we're having, quite frankly, I think the Funders Council, with all the love in my heart, I say this, I think that we are having two different conversations. And so they are having one conversation, right, January 2023. We're having a conversation that is April 8th, 2022. And while it sounds like it's all the same, it isn't. And so I personally don't think I can't make a motion and all that, but I don't think we should be taking action on a priority population for 2023. And I'm not sure we can take action on a priority population right this minute, absent knowing what the funding sources can do, right? Kevin. You're acknowledged,
Well,
Kevin.
you're actually speaking, you're actually in my mind, like, we've done it like half a dozen times. I think we need to be clear on what the time frame is. I think we need to do a survey of our community provider resources at that time frame. For example, if I'm developing a PSH project, there's only a few being developed at a time, right? And so if there's not going to be another project like that for a year, 2 years, then it would be in the best interest of the funders and the community to prioritize for that type of, whether it's for families, whether it's for individuals. Otherwise, the opportunity gets missed. Resources not be able to even make a decision on this. Now, things like rapid rehousing and prevention, they're a little bit more scalable. The challenges and barriers you have there are we successfully finding landlords? Are we able to find the housing that we need for people to acquire?
So much Kevin's in this room right now. Thank you, Kevin. The data that's up here, I don't know if we want to just look at it for just a minute, some of the data that was provided. As you can see here, can you read it to us, Amy? Hard for me to see it.
Yeah, so one of the things that's kind of new, and it's on your agenda to talk about in a little bit, is that we typically don't have a lot of people who fall in that self-resolution, navigation only need category. And so we had a lot of conversation about why is that happening all of a sudden? Is it that people have money to sustain on their own and they just need help finding housing? Is it that we have people who are newly homeless for the first time ever? And so they, the VI stat assesses trauma, essentially, right? So they wouldn't score very highly on that. So this tells me that we need some interventions that are not any of the interventions we have proposed at this time, right? So rapid rehousing may not be the solution, PSH may not be the solution, and we've got to start connecting the dots for case management to understand it's not 0 to 3, you don't get any help, goodbye. Right. And so we're going to host some HLA trainings around that and also try to dig down and figure out which of our assessors, maybe it's an assessor problem that one particular assessor is continually scoring people low. And if so, get to the bottom of that. So that's kind of what's shown in the first row. The second row shows that right now we have 1,100 individuals awaiting rapid rehousing. That is not awaiting to find housing, they are waiting for referrals. So that's a lot of folks, that's an 89% increase over last year. In one of the data tables I had Brianna send you by email, you'll see we have tripled and quadrupled the numbers we're surveying. So this money has done good. It just, there's still a lot of need. Our average monthly inflow is 17. So, we've got to be able to keep up with that inflow. That is a decrease, which is, I think, why funders probably said, all these prevention dollars are working. We've got to make sure that we have prevention on the street. And then PSH has had a 38% increase. There are 267 individuals who need that. With 7 coming in a month, and only 1 leaves permanent supportive housing a month. So, we're never going to keep up with that. For families, this is what it looks like for families. We have about 5 families right now scoring in that 0 to 3 range. We have 56 families awaiting RH with an inflow of 19 a month. And for PSH, we have 11. All of those are increases for who's been waiting since last year, but our inflow has decreased a little. One of the things that I think is really eye-opening that I'll show you real quick, this is some of the numbers from Florida Housing Finance to show that our need for supportive units in our community is large. For chronic individuals, we would need 646. I won't read this out to you, but then you can see something Dr. Cantrell is always telling us about. We have all these families in hotel, motel, and doubled up because we don't have enough affordable units. And then when we add everything, when we look at DV, child welfare, prison, everything, there's the need for more than 35,000 units. This is just for our county, and the cost for that is $806 million for supportive units and $7.7 billion for affordable units. So this is, we've reaped what we've sowed, that our representatives have taken those document taxes year after year and robbed them. We need advocacy around that is held for affordable housing. I think, there's no way to build our way out of it at this point.
And that's what I think happens, is I think we get in a room with funders and maybe even, community stakeholders, and they hear this and it feels too big. It feels like literally we can't build our way out of it. It's just, it feels overwhelming, and I feel overwhelmed too. I'm sure all of us do, which is why I think that, backing it up and looking at, kind of what can we do right now today? How do we get 70 families off the street? How do we get the 70 over age 70 off the street? It's like, how do we just start to, to address the problem? Because we aren't going to build our way out of it. We're certainly not going to build our way out of it by September. And so when I hear, for example, that we might lapse $2.7 million in the county, and that we actually have county staff who are feeling like just throwing their hands up, like we can't do it, and we're just going to let the money go back. It's like we've got to. I feel so strongly like we just got to get our arms wrapped around them, help them, encourage them, do whatever's necessary that they feel like it actually can be done. One thing that Amy said earlier about, it might require an amendment that takes weeks and weeks on end. We don't have time maybe for the amendment because the buckets are already set. One of the things that I just want to say that is, and I'm probably not the one to say it, it probably needs to come from you or maybe from HUD, but HUD is not interested in taking anybody to jail. HUD is not interested in handcuffing anybody. And so there is an ask permission, beg forgiveness policy, right? And so sometimes we have to do things, in my opinion, and then beg forgiveness. And I realize that
is talking about county government.
I know, and county government, good God almighty, but I'm just saying that there has to
The
be.
ends justify the means.
But I do think that there has to be, again, it's around risk tolerance. So maybe there's not a risk tolerance for $2.7 million, but maybe there's a risk tolerance for, our county has a lot of money. We can take some risks on some of these things. In any case, so
But they can do amendments quickly if they really want to. Amendments can happen, especially with the provider, if you extend the contract or volumize it or do something with it. You can do it a lot.
I think it's with the HUD.
It's not
Yeah,
PCC amendment, it's a HUD.
it's a HUD amendment. Yeah,
Yes.
it's a HUD amendment. Okay, so I don't believe we should take action, quite frankly, on the target populations unless somebody feels differently. I think we should allow Karen to try to do what she's committed to with Amy to see if we can't. I'm certainly willing to convene a providers council if we need to in between, right? Would everybody be in agreement of that if we had to get together?
And I do think it's fine if you don't. I do think, like Teresa, for example, she gives this to her social action funding group and they use it to help make decisions when people are tied and that kind of thing. So I just want to make sure everybody understands how these priority populations are used, is that they are presented to the volunteers who score your funding applications. And I don't know what they'll do without it. They may keep last year's, they may say, no, you're on your own, figure it out.
There's a pretty important deadline is what you're saying by Kate.
Well,
So I agree with the sentiment that we need to take action on what exists today, but to sacrifice the future. for
we're not,
today.
I disagree that we'd be sacrificing anything. We have priority populations in right now with the unfortunate maybe decision that was made, I think last year or the year before, was the priority population. They were not in priority order. In other words, the priority populations, am I remembering that correctly? The priority populations and, check me if I'm wrong. I believe it was families with dependent children. It was youth aging out of foster care or the elderly.
I think it was just seniors 62 and up and families with children 0 to 5.
And is this committee in any way focused on the opioid epidemic in our county?
No,
That's-
not specifically in this particular.
The reason I ask is because it sounds like a lot of these issues would coincide with them. And that's why I'm wondering,
We actually have not seen a strong correlation between the two. So families in particular, we're not seeing families in particular who are homeless and or on our list who are impacted and or caused by the opiate epidemic. The individuals certainly we know are having co-occurring issues and, you know, living on the streets. This-
See that data, my data says exactly the opposite. So
Yeah.
It's interesting.
Sure.
Well, I was just thinking, if in fact, funders are already looking at things, we still wouldn't be able to pull anything together that would deal with the 70 families that you've been talking about. And so I think the opportunity comes if Karen is able to talk with people at the county and with your help, figure out we could do something like you put up on the screen to get them out of the woods immediately. You're not going to build anything overnight to solve this problem. It's going to have to be something unique that's created outside of the box between now and September 30th, but that pile of money.
So, I mean, we could ignore the funding, the action that the Funders Council took. In other words, not use that to consider the priority populations if we believe perhaps there's an opportunity that funding priorities could change between now and a couple of months. I don't know if they can or they can't. You know, in the presentation that they sent you, Amy has presented 3 options for that 2.7 million so that it would not in fact lapse. If we maybe not ignored, but if we thought perhaps that the funding priorities could change, and I believe they certainly could, if they could change, then we could take action today on priority populations for local funding, to Amy's point. I would be fine doing that if we think that there's a likelihood that by not taking action, that our social action funding and our other local funding opportunities that are happening kind of right now, you know, that it would not give them the direction that they needed to review the applications. I would assume that we would fall back on last year's, but you know, maybe that's an assumption.
And just for transparency, human services social action is open now.
Yeah, and I think
Cities will open
St. Pete's is
by
coming.
May 1.
Yeah, it's coming.
Tis the season.
Yeah, tis the season. Okay, so what is the will of the group? I'll look over this way. Guys,
Can you, if we would choose a population of 2 or 3 today, we can amend that, correct?
Sure, we can, but once we've taken that action, right, unless something pretty significant changes, you know, we might be sending mixed messages to people. I will say, for the point of this discussion, on a bullet here, priority population for street outreach. So one of the things that we are working on in collaboration with Pinellas County Human Services, 211 and others, law enforcement and others, is really prioritizing for the purposes of dispatchable street outreach, because it's going to be a very, very small pilot, is focusing on seniors, those 62 and over. So last year, we all took action here that one of our priority populations was seniors over the age of 62. In fact, we've taken that action for a couple of years running, but that population tends to grow. So I say that to say that if we take action today, I personally think that families with children 0 to 5 and seniors 62 and older need to be on that priority population list.
Weren't they the same ones last year? Didn't we have those?
Yes.
So we're really not changing it. If we don't vote, it's the same as it was last year, the first 2, correct?
But does that conflict with Bill for Zero?
I mean, we're already doing that work, so.
Is this a situation where we have to rank everything again, 1, 2, 3, 4, 5?
I believe we should be
You
doing
should,
that.
but you never have.
No, that's
so-
not true. We did many years ago,
We have,
and
we
then
did,
people
and then
get,
it all-
but people get real
Yeah.
anxious
Yeah,
about
that
that.
was awesome.
Yeah, we get real anxious about that.
2018.
So-
When y'all did the dots around the room in JWB, I
Yeah,
remember
yeah.
that year.
So if we don't have to rank them 1, 2, 3, 4, 5, We just need to identify the priority populations, right?
Well, maybe. I mean, I personally believe that it is more helpful to our funders, social action funding and blah, 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 if we in fact rank order them. If we don't rank order them and instead we say, everybody is important, and therefore social action funding and other local funding sources could choose any project that they so see fit, right? The question is can we really make a dent that way, right? So when we think of collective impact and those kinds of things, I think getting real specific can be helpful. But to answer your question directly, no, we don't have to. Should we? I think we should, but we don't have to.
Just thinking, if we put our priority populations out there, isn't it the work of the county and the people in this room and the providers to find who gets housed?
What do you mean?
And I'm trying not to sound sketchy,
Yeah,
but.
you're sounding
that's-
sketchy by
Yeah,
trying not
I
to sound
know.
sketchy.
I'm aware.
Just tell me, just spit it out.
Yeah. Yeah, right. Get the term, yeah. No, if we put all of the populations out.
Yeah.
Not all of them, but our focus groups.
Yeah.
Without ranking.
Yeah.
It's the work of the providers and the people pulling these families and these individuals off these coordinated entry lists and put them into housing.
Yeah.
It's the provider, I mean, we're still inside of our own little silos. Each person is picking which people, individuals, families get housed. So if the providers know what they're doing, then it doesn't matter how they're ranked, right?
Well, I don't know.
It's actually kind of interesting because, so the purpose of this exercise is to tell funders what they should prioritize in grant applications, for example. But let's say they do that. Let's say they follow whatever direction you give them today. Our coordinated entry prioritization scheme still may not allow
Right.
for that, which is what I think you're trying, like, people are still gonna get referred the way they get referred, and whatever funding is prioritized, it doesn't really matter unless you then also take up coordinated entry reprioritization of that schema.
Thank you for churching that up.
I don't know what you're trying to
That's what I'm-
say, but
No, exactly.
I mean, I'm thinking about seniors, like, I'm horrified at, I mean, 783% in the last year, and then Nikki's team presented this data yesterday, and I wrote it on a sticky note to bring, and I didn't, but in September or October, they were getting 200 calls a month from disabled seniors, and this month it was like 1,100. I mean, it's significant.
54 of them in the shelter right now, and the
Yeah.
vast majority, I think there are a handful that make more than $1,000 a month. And convincing them to go and spend $1,000 of all of their income to go live in a skilled facility
That's right, the rent's
is impossible. So I'm very concerned about the seniors, but I also understand that we need to be concerned about 70 families living in the woods or cars.
Those two are my top two as well, and I don't, it depends on the day and the minute of the day that you ask me in terms of which one I think, right? All I can see is my dad, right, living on the street right now, and it's like we as a community have to be better than that.
The kids turn into the adults, I get it.
Yeah.
But you're saying that's an increase in shelter then?
Oh my gosh.
Yeah, because when we first started talking about it, I think we had two at Pinellas CoC, and I think we had a
Yeah,
handful
handful, probably.
with Safe Harbor. And now here we are with 50 here and, another
What type
50
of influence
there.
do we truly have over rental and prices? Because I've noticed them jump considerably, to the point where people aren't necessarily leaving our care because, they can't find affordable housing. So at which point, what influence do we get to have with the 2.7? Is that, are we going to be able to address rental prices and give them some subsidies?
No, the 2.7 won't really have much to do with the, with rental, with rents and those kinds of things. There's other advocacy action. You know, a lot of our city councils are actually looking at and considering action around rent control and those kinds of things, working with builders when they build in communities, a certain number of units that have to be set aside for.
So it won't affect the funding. I apologize for the silly question.
No, it won't, not for the 2.7 million, it won't impact that. Okay, so let's revisit this then around priority populations. I so wish that we had better internet connection and we could hear from our providers on the Zoom. But from the people in the room anyway, what action do we want to take around prioritizing populations?
I don't think it's gonna hurt us to do it only because we're probably gonna end up where we were before. And it's probably gonna be the same the same group of people or close to it.
Do we have the lists from previous years?
What is the time period again?
It's in the minutes.
It was in the minutes from.
What do you mean, Kevin?
What time period are we voting on this being a priority for? 2023?
No, it's for the
Because
social
every single year-
applications open right now.
Yeah, that's the. way-
Okay, so right now,
Maybe that's the way to do it. Just vote for a particularly funding stream right now. And
You can do
then
whatever
we
you want.
can change it later. So you can vote for social action funding for right now. This is our priority. And then we can vote again.
I do want to acknowledge Jennifer in the chat, her top three, she's saying, and I'm assuming, Jennifer, that you've got them in priority order: families, seniors, individuals who are chronically homeless as your top three.
In the past, we also included unaccompanied youth.
I don't see how we're going to change the units in short order for the urgency of now. I would, even if we change this target population for social action fund, how is there going to build more units right now?
It's not. I don't think it's intended to. It's intended to help our funding partners, like their review committees and that kind of thing, when they release their RFPs and that kind of stuff, that there is there are target populations that those funding sources are designed to help. As opposed to.
But the help we need is units.
So Ashley just said that HUB's gonna reopen their 8 family units that they've been using for COVID. So that's great news. They're gonna open on May 1, and CASA has said their priority would be families.
Was an emergency out of 70. Takes a little bit off. And then 8 more will fall right back in. And
That's the problem is.
yeah, it refills for everyone you get off, another one refills in.
I guess that's why I'm so new to this. The puzzle piece is so much more complex than I ever imagined it would be, based on the different bureaucracies y'all are talking about. But when we add in additional support services along with these housing opportunities, it seems like we have an opportunity to help people not fall back in potentially. All these existing things all have an end date. So that's I'll stop.
Robin Red, who used to sit on the board, I saw her on Monday, and she is building 71 affordable units, I believe, that are for special needs populations. And she posed an idea. I don't know if it would be allowable with whatever funding source she's using. But she's like, Amy, if the provider is willing to provide case management and everything else, maybe I could save aside 1 unit that is temporary for 60 or 90 days that can be like non-congregate shelter. And so I don't know if we have other folks who could do something similar, or we could get our housing authorities to consider doing that. It's going to vary by funding source what would be allowable, but I just thought it was a creative idea of, you know, I'm building something, I don't have somebody in the units yet, I'm willing to set aside 1. To your point of, you know, 7 more is 7 more.
That's an interesting idea. setting aside a permanent housing option to be used
As a,
on, yeah. I mean, which is kind of,
Temporary.
yeah, which is kind of like how the family bridge and
master
family,
lease, yeah.
yeah, Matt, right, lease was working. Okay, so I've heard, it sounds like we're pretty split in terms of the number one top priority between families with children 0 to 3 and seniors 62 and above, unaccompanied youth or youth, aging out of foster care, and then chronic homeless. Does anyone want to try to put it in a priority order so that we could take
Do a
action?
tie for the top two, list the others under.
We could.
Yeah, it's hard to say seniors over families or families over seniors. That's difficult. I would say tied for those two and run the others. If I have to prioritize, I personally would prioritize families. Because families are harder for funding. Families are harder to place. A senior, you could place in a 1-bedroom. Funding wise, but I would hesitate prioritizing the one over the other.
And I think your point earlier about large families, those become even more difficult.
Those are the reasons I would place families over seniors if I had to rank one or the
Even
other.
families when they're trying to find hotel room, they can't, if they have over 5
You
children.
have to get 2 hotel rooms. We
Yeah.
do that quite frequently.
And we get it denied for reimbursement quite frequently too. We have 2 hotel rooms for one family, just to be clear. Okay, so what's the will of the rest of the group?
Tie. For the top two.
Tie for the top 2?
I like that idea.
Yes?
Yes.
I'll make that,
Here.
I'll second that motion.
Wait a minute.
Okay, so the senior 62 and over and families with 0 to 3 children, are we identifying the 0 to 3 in that or no?
Did you make the motion?
0 to 5?
0 to 5 of them.
Okay, 0 to 5, excuse me. Okay, 0 to 5 as our first priority. Is that the motion?
Yes.
Okay. All those or any discussion, anybody on, do I have a second for the motion?
Kathy made
Okay,
the motion,
second,
I
okay.
seconded it.
Okay, so anybody on Zoom that we can hear that would like to contribute, you please use the chat feature. If we can't hear you, please use the chat.
What about families with 5 and older? That's a lot of what we see, so.
That's the next subcategory.
I think we do that. That's probably a good.
Okay, so our first priority is shared by 62 and over and families with children 0 to 5. All those in favor say aye.
Aye.
Opposed?
Aye.
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 Okay, priority number 2 on the list, I heard families with children of any age or over the age of 5, so school age children, basically.
And then you have unaccompanied minors, which we've had before as well, so I don't know where they would be in that. Once you get past this too.
What is that population? Just.
It's 18 to 25 typically.
Usually singles.
No, the percentage of unaccompanied youth.
Oh, it's really small. It's under
Yeah.
200,
Yeah,
250.
You gotta concentrate on the big ones.
yeah.
Or maybe you chip away at the small ones and get over the line. I don't know.
I don't know, it's hard putting a 22-year-old in a lease by himself, right?
Jennifer has her.
Yes, it is. Jennifer?
Yeah, I'm sorry. I know the connection's not that good. I didn't mean to vote aye for seniors first, so just I put opposed. I don't know if that was, what you were trying to do, but I put families first because I guess working with families, I can't imagine children being on the street as opposed to a senior. I can relate to the seniors. My dad's 84, but I'd rather have a senior on this, not have a place to stay than a baby. So I just wanted to take my eye back if that was what you guys are doing.
Okay, yeah, and just so you know, the motion, Jennifer, was that we are prioritizing for priority number 1, both seniors 62 and above and families with children 0 to 5.
Perfect. Okay, thank you then. Thanks.
And Dolores says, I think severe mental illness needs to fall on the priority list as well. I agree, Dolores. So let's talk about the second priority population. I've heard families with children, school-age children, unaccompanied youth or youth aging out of foster care. I'm hearing the individuals with severe or persistent mental illness. What do we think?
What is the likelihood of the, because, you know, we have foster care that age out too. The challenge is them getting into an apartment at that age. So I don't know if you guys experienced anything with that. What we struggle with foster care youth, they just want to get out of the system. So it's challenging for us to even keep them around to get them in a place. I don't know if you guys have experienced that. I mean, I think it's needed, but I just don't know how likely they are to get into an apartment at that age and sustain it. They have to be on independent living.
Correct.
You know what I mean? So in order to afford everything.
Correct. And you know, we have relatively few of them who are actually coming to our attention in the grand scheme of things. I mean, we often have them because they have become pregnant and or recently given birth, in which case we then have them. We are not finding it difficult to necessarily get them into a lease, but and they are a priority population for our vouchers. And so we're able to get them a voucher if they've become pregnant and or they've had a baby. But nonetheless, there's relatively few of them in the grand scheme of things. They're the easiest, quite frankly, because of vouchers.
I'll just fully own up for providers. So if you want to talk to me about this offline, we will not, as a community, be applying for the HUD NOFO that's available for that right now either. I don't think our data supports it, and it's a significant lift that I don't think can be accomplished.
Yeah. I do see Kevin has said chronic homelessness as a priority population for consideration for number 2. Vicki.
Again, if we're needing motions to move this along a little bit, I'll make a motion to have as a second priority families with minor children 6 to 17, I guess.
Okay, so we have a motion and a second on the floor for families to be second priority, families with children 6 to 17, so school-age children as a second priority.
What was the second? No, sorry.
So any discussion? Any discussion online? Please use the chat feature if you're having a hard time being heard. Any discussion in the room? Hearing no discussion, all those in favor say aye.
Aye.
Opposed? Motion passes. Okay, third.
Homelessness,
That's what I was thinking.
it's gotta be. How many individuals did you say there were?
1,100,
And how many were there last year?
500.
No,
It's doubled.
but that kind of tells you what it should
What
be.
I will say about chronic homeless is I do believe that number, and maybe we need to say it this way as our third priority, but in my opinion, individuals who are chronically living homeless often also have severe persistent mental illness, co-occurring substance use issues, veterans, DV. In other words, I think some of the kind of subgroups that we are often concerned about fall into that bigger, larger bucket, which is why I think it's as big as it is, quite frankly. And so Kevin makes a good point. It's a part of the criteria of chronic, everything that I'm saying. So thank you, Kevin. So
So if you say chronic and potentially chronic homeless, that encompasses everybody, because they're all gonna become chronically homeless with their issues, as long as they continue to not be housed.
If you get a Venn diagram, yeah.
Yeah, exactly, yeah.
So just simply say less chronic individuals with mental health.
I think what Kevin is saying is that it's almost,
A part of the chronic.
it's a part of the chronic criteria. It's almost repetitive to have to say it, so.
But considering how this is used, it couldn't hurt, right? So we're preaching to the choir here. If you're a volunteer that shows up at the city or the county once a year to score applications, you probably don't know the official definition of chronic and may not understand that that includes people with severe or persistent mental illness and, you know, things of that nature.
Maybe
So
those definitions should be passed out as they go to review the applications.
I will tell you, just for the sake of this discussion, that a year and a half ago, when Directions for Living submitted an RFP for the re-posting of street outreach, we identified our top 4 priority populations for street outreach, interestingly enough to this conversation, as seniors 62 and older, families with dependent children, chronic homeless living with severe or persistent mental illness, and unaccompanied youth or youth aging out of foster care. And so that was the 4 populations. You know, they've historically been our most vulnerable groups that we've been trying to get our hands around. And so it's just consistent now, a year and a half later, even with this conversation here. Does anybody want to make a motion for our 3rd population? Priority population.
That motion that we have the chronic.
The chronic, so chronic individuals or individuals living chronically homeless. So we have a motion. Do I have a second?
I'll second.
Okay, I have a motion and a second. Is there any discussion with people on Zoom or in the room?
And I think the one thing I would do in the notes or as we move forward is, yes, put the definition of what chronic is so that they know we thought about that, talked about it.
There's a consistent operational definition of that everybody understands. I think that's.
So we could say by HUD standards, as defined by HUD standards, and then make sure, so that goes in the minutes, and then that's what we would provide to the jurisdiction.
Like the bullet point version, not the 3
Yeah.
page.
One font, one font.
Whereas
Look, there's like a 28-page PowerPoint to figure out if somebody's chronic or
Right.
not, seriously.
Okay, so we, all those, did I say those? All those in favor say aye. Opposed? Okay, very good. Motion passes. So we have voted on the top 3 priority populations. Do we want to take action on a 4th priority population? The only one that I feel like that we haven't talked about are those aging out of foster care or unaccompanied youth.
And it's so minor that when you get there, you're gonna try to have funding.
Yeah, full program funding opportunities are probably not really necessary
It's
for,
very minor.
because we're all wrapping around them anyway, the minute we hear about them. All right, is there any will of the group to further prioritize populations?
Well, I think we should acknowledge the unaccompanied youth, even if they're number 5, just so that they're not missing from a priority population.
Okay, so we've done 3. Do we
Okay.
want to do 4 as unaccompanied youth and those aging out of foster care?
I mean, that would be my recommendation.
Well, you have to do it in a motion. Do you
I
want
have
to
a
move?
motion.
Okay.
Yep.
All right, so we have a motion. Do we have a second?
Second.
Okay, so we have a motion and a second that our 4th priority population will be youth aging out of foster care and unaccompanied youth. Any discussion? Anybody online in the chat? All those in favor say aye.
Aye.
Opposed? Okay, very good. Any further action? Does anybody? Yes.
Just over to Karen's point,
Okay.
those kids still fit in that chronic category because they are homeless and they often have mental health. And I have a number of them in my programs.
I do think, you know, kind of saying it out loud, right, helps people to know that we have not forgotten about this very vulnerable subgroup of another group kind of thing, but thank you for that. Okay, all right, getting back to the agenda, we are well over time, I see. I don't know that additional information is necessary around the priority population for street outreach. We're moving forward with 62, over 62. We are working with a large group of people. Was there anything else that I was going to say about that? Okay. Moving on to the next agenda item, which is coordinated entry policy on those scoring 0 to 3. I think Amy mentioned a little bit about that, but
Yeah, and you will be getting a complete coordinated entry update in your next meeting. So you'll have a 200-page book to read and approve. But I felt like since we're seeing this in the data, it was important enough to bring this policy to you in advance of that. And really all it is outlining how are we going to manage this from an assessment perspective, and you know, what assessors should do whenever they have somebody in that 0 to 3 range. Since we're seeing more of it, it's pretty straightforward, the policy that was presented to you, and we are looking for approval.
so did everybody have an opportunity to read it? It's in my packet, it's the last page. My only question was, I was just a little confused where it says, if the coordinated entry assessment score is above a score of 3, the individual and veteran will remain on the by name list and wait for a referral to a housing intervention. Next paragraph, if the assessment score does not change or is below a score of 4, the household will be removed and the entry into coordinated entry will be closed. The veteran should be referred to the Veterans Association for additional resources. So am I?
That is after the reassessment stuff that happens in paragraph 2,
right?
Avery, if you want to jump in, but that, when I read it, that's how I read it, was that you were going to continue to try to assist them, possibly reassess them, determine if maybe their score was inaccurate. And then if that didn't change, that's when we wouldn't continue to try to manage folks. Avery, did I explain that right?
That's it. That's correct, Amy. That is correct.
I remain confused. So if I'm reassessing them, right, every 30 days, the provider should update the coordinated entry assessment to determine if household circumstances have changed. If a veteran enters back into the system for shelter placement, was referred to HLA veteran navigation team, or is not eligible for rapid resolution, the provider should update the coordinated assessment to determine if the household circumstances have changed. If the coordinated assessment score is above a 3, above a score of 3, the individual and veteran will remain on the by name list. If the assessment score doesn't change or is below a score of 4, so that's just where I'm getting confused, is the score of 3 and above versus under 4. I mean, is it just me that I'm maybe my brain's just not wrapping around it?
No, it's my age, I'm not wrapping it.
Can you help me with that, Avery?
I'm looking at it too, April, and I think it's just semantics of looking at it. If you want the common language, we can use the same language.
I just think that would be helpful. That
Okay.
we're talking about a score of 3, or we're talking about a score of, over 3, or a score of under 4, right? It's like
It's the same.
I see what you're saying.
You see
It's
what
the
I'm
same
saying?
thing, but yes, I see the need for being common. So we'll go ahead. We can make that edit for you all.
I do want to kind of preview for you that you see 30 days mentioned quite a bit in this policy. Right now, your inactivity policy is 90 days. That is out of alignment of many COCs, and that's a part of the coaching we're receiving with Built for Zero. So it is likely when you see a coordinated entry update that we may be looking at a change in policy, that inactivity would be at 30 days and not 90 days. So just want to kind of preview that for you as well.
Okay, and are we kind of taking that back to our staff to tell them that we need to be re-evaluating every 30 days and not every 90?
No,
No,
This is about remaining on the binding list.
Yes,
Okay.
So if they're,
yeah,
you know, on the list.
Okay.
They're come off. Gotcha.
that would be. I mean, your staff would shoo you out.
I
the
thought for
door.
sure I'd be like, I think they will run me out of town.
Right.
I'm not sure I'm gonna have a place to
Every
live
30
soon.
days, yeah, no.
Who are we reaching out to for if we need case conferencing through CES? Carly?
Carly would be it, yeah.
Okay, so we are expected to take action on this today. Is that correct, Avery?
Yes.
Okay, can I get a motion to approve the coordinated entry families with 0 to 3 coordinated entry assessments for
With
policy?
with
With the
changes,
change.
I vote that we, a motion that we approve the policy with the recommended changes of the language of 3.
Do I have a second
Second.
before you leave? Okay, we have a motion and a second to approve the coordinated entry policy for those scoring 0 to 3. Any discussion online? Anything in the chat?
This is from Dolores about making sure people don't forget about FSI and wanting to know about the family by name list, so I'll make sure she gets connected with Carly.
Okay. All right, all those in favor say aye.
Aye.
Opposed? Motion passes. Thank you. Okay, program updates and general announcements. If we do still have about 8 minutes.
My portion of this could be quick. It was a light agenda knowing that the prioritization could take a while. So we don't need to touch on new programs or program changes that can come at a future meeting. Funding opportunities has already been covered. City of St. Pete should open next month. County is open right now for social action funding. So if you haven't seen that, definitely check it out. I do believe consolidated plan for the county just recently closed. So some information should be coming out. All of our jurisdictions are working on their home art plan, which then means those will open next. So we'll keep pushing those out to you, but lots of opportunities becoming available. And then the last thing I wanted to mention on this was many of you were invited to the vet leadership meeting. I know it was spring break week, so a lot of folks couldn't show up. But our veteran system is doing things very, very different than our COC. The veteran system is required to follow COC policies. So this is kind of our last horizon, right? You know, we spent a lot of time getting rapid rehousing and housing first done, and now we're looking at PSH and we're looking at our vet world. So we really do need your seasoned voices in the room for that. Right now, the people going to the vet leadership meeting don't know any of this stuff you are doing. In a future charter change, we will make them a part of the charter so that they have to be a part of the COC and not this separate thing that y'all have never heard about. So I just wanted to encourage you that the next meeting, if you can attend, we really want our providers to help inform what makes sense. Now, some of those rules have to be different because for the VA, their rules are very different. But anytime we can have alignment, it would be much easier for providers to have alignment instead of we do it this way for vets, we do it this way for non-veterans. So wanted to keep you in the loop around that. Okay. I know that Sheila wants to make an announcement. And before Sheila makes her announcement, I have an announcement. Many of you are aware that about a year and a half ago or so, Directions for Living took on a huge initiative around mental health first aid, getting everybody trained in mental health first aid. We've trained most of the organizations that are represented here and really across the county. Anyway, we were notified last week that we were selected as the only mental health first aid organization of the year for a national award based on our mental health first aid initiative. And so we're so excited. So several of my staff and I will be leaving tomorrow to go to DC to accept that award at the National Council Conference. And we've notified our funding partners, Pinellas Community Foundation and the Juvenile Welfare Board, both contributed significantly the funding to make that happen. And we're just so excited. All right, I want to make sure you have time to give us your announcement, Sheila.
really don't want to give it. I'm retiring as of next week, well, the 19th of April. Congratulations.
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 It is bittersweet as far as I'm concerned that Sheila would be retiring. For those of you online, Sheila has just announced her retirement. Actually coming fast and furious here next week will be her last day. Right after Easter with St. Vincent de Paul. Sheila has given so much to this community around this issue in particular, but in so many ways.
30+ years, lots of different providers.
Yeah, amazing. Yes.
50+ years.
50+
Yes.
years.
I would say that.
I was 28, I'm now 82, I'll be 82.
Wow.
A long time. You'll see me in the park.
Well, I hope that we'll have the opportunity to see you in a lot of other places as well. And I will be thinking about, I hope we'll all be thinking about ways that we can keep you involved. And I just think it'll be good for you and for your mental health to keep you doing something. Certainly, I understand and appreciate, right, not a 40-hour or 80-hour week, but doing a little slower pace, doing things, but doing something, and certainly keeping your brain sharp and the knowledge that you have that we can.
I enjoy very much, even taking minutes on each one.
Kevin says he has a board position ready for you, Sheila.
That would be good.
Thank you, Cal.
That would be good. All right, any other announcements from anybody online? Anybody in the room?
How cool is that?
Good night.
Okay, with that said, motion to adjourn.
But it's not read it.
Thank you. Have a great weekend, everybody.